If Tretinoin has ever made you feel like your face is literally peeling off, you are not alone. You might be applying it wrong, and that's not your fault. It's because no one has taught you the dermatologist method. There is a right way to use Tretinoin. There's a right strength, a right schedule, a right way to layer it, and a right way to know whether what you're experiencing is normal. I feel like most people starting Tretinoin get a prescription, get maybe 1 to 2 minutes of instructions, and then are essentially left to figure out the rest on their own. And then they suffer through weeks or even months of unnecessary irritation, or they quit Tretinoin entirely, and they miss out on genuinely one of the most effective skincare ingredients that we have. And that stops today. Welcome to Derm Office Hours. I'm Dr. Sam Ellis. I'm a board-certified dermatologist in Northern California. I treat thousands of patients a year, and I am here to give you all of the insider tips. So, if you're new to the channel or you haven't liked and subscribed, make sure you do that right now because I don't want you to miss one of these. In today's Derm Office Hours, I am giving you the exact Tretinoin roadmap that I give my patients, how to pick the right strength for you, how to ramp up, how to layer, what to avoid, and how to tell if your skin is purging or just angry. And make sure you stay all the way to the end. The last section is our troubleshooting segment where I answer your real questions from my comments. If something isn't working, there's a good chance we're going to answer it. Let's start with the question that actually makes or breaks Tretinoin. Should you be using it? Tretinoin is a topical prescription strength retinoid, a vitamin A derivative that has decades of clinical research behind it for acne, fine lines, hyperpigmentation, and texture. And it's also safe to be used by all skin tones. When used correctly, it delivers results very consistently. So in a world of kind of overpromised skincare ingredients, Tretinoin deserves its good reputation. If you are pregnant or trying to get pregnant, Tretinoin is contraindicated, meaning that it is off limits. But I have a whole other pregnancy skincare video that you should check out if you want recommendations for that. Also, if you have eczema or a significantly compromised skin barrier, it's really important that you heal your skin barrier first. If you try to put Tretinoin on irritated skin, it's kind of like putting salt in the wound. And if you have rosacea, you're not automatically excluded from using Tretinoin, but there are certain formulas we should look for and special ways that we should think about incorporating it. First, let's talk about the right strength of Tretinoin to use. It ranges from 0.025% all the way up to 0.1%. And here is my guidance and my personal approach around this with my patients. Almost everyone should be starting at that 0.025 concentration, the lowest strength. When it comes to using Tretinoin successfully, we always talk about how it's a marathon, not a sprint. Your skin has to go through this process called retinization where it gets acclimated to it. So rather than starting with a high concentration and making that retinization process really painful, I almost always will recommend starting with that lower concentration so that ramp up process can be a lot more comfortable. And then once someone is able to use that lower strength of Tretinoin successfully, meaning every single night without irritation, then you can go up to the next strength if that's even indicated at that point. The other thing that's really important to understand about the varying strengths of Tretinoin is that if you are using it for anti-aging, the 0.025 concentration has shown the same efficacy as the 0.1%. So there's really no reason to use a higher strength of Tretinoin if your goal of using that ingredient is just to age more successfully over time. We have those higher strengths of Tretinoin like 0.05%, 0.5%, and 0.1% for the treatment of acne, because there's good data to say that if your acne is not well managed at the lower strength of Tretinoin going up in the concentration, as long as you can use it consistently, can help you get better control of your blemishes. So higher strengths are there for acne, not for anti-aging. And then aside from the concentration, your Tretinoin can also be put into a gel or a cream or a lotion. Tretinoin in the cream format tends to be the best for dry, sensitive, more mature skin. It also tends to be the one that is best covered by insurance, but you know that's going to vary a lot because insurance is wild and unpredictable. In contrast, Tretinoin and gel is going to be lighter. It might absorb a little bit better for some people. And so if someone is very oily or just likes the feel of a gel format better, that's when I will prescribe that one. And then when it comes to lotion, to my knowledge, there is no generic Tretinoin and lotion. So if someone wants more of a lotiony format, they may have to pay a higher price to get that brand name. So let's say now you have your prescription of Tretinoin in hand. How are you going to incorporate this? What schedule are you going to use so that you can ramp up effectively and efficiently and reduce the risk of irritation, I'm gonna give you a very specific schedule, but the gist of this is to go slow. The same way when you're starting an exercise regimen, sometimes people are so excited to get in shape. They're like, I'm gonna go to the gym every single day and hit it hard, but then they end up so sore or injured that they can't continue on their journey. And the same thing goes for Tretinoin. When we are first starting, we are going to be spacing out the days that we use it so that our skin has time to acclimate to it and we reduce the amount of irritation or soreness that our skin experiences. Now, everyone's schedule is going to be a little bit different, but I generally say for weeks 1 and 2 of Tretinoin, you're going to use Tretinoin 2 days a week and you're going to space it out Mondays and Thursdays. If you go through those first 2 weeks of using it on Monday, Thursday, and you don't notice any flaking or irritation for weeks 3 and 4, you're going to use it every third night. So just ramping up that cadence ever so slightly. If you are able to use it every third night for a couple of weeks, then for the next 4 weeks, an entire month, you're going to use it every other night. And if you're able to use it every other night for an entire month without issue, then you can start trying to use it every single day. Now, if at any point during this ramp-up period, your skin starts to be red, raw, feel irritated, get flaky, or maybe it doesn't even look bad, but when you apply your moisturizer or other products, you experience some stinging. That is a sign that your skin is feeling a little bit stressed out, and we need to back off on the cadence. So let's say you start using your Tretinoin every other night, and you're noticing some sign of irritation, you're going to pause your Tretinoin use. You're going to use as many days as it takes off from Tretinoin for your skin to feel good, and then you're going to go back to using it every third night. That was the last cadence that you were able to tolerate successfully. You'll do that for a couple of weeks, and then you're going to try going to every other night again. It took me a full 6 months to be able to work up to using Tretinoin nightly. So although this is a framework for how to introduce it, everyone's individual schedule will be slightly different. Now that you have a schedule for your tren, let's talk about how to actually apply it, because I feel like this is where some of the tutorials or the instructions fall short. You will have the most consistent, predictable results if you are applying your Tretinoin on clean, dry skin. So for a lot of patients, that means you're going to wash your face in the evening, pat it dry, and then let it fully dry for 10 to 15 minutes before you go in with your Tretinoin. And I know that's not particularly convenient, and some of you won't need to wait that full 10 to 15 minutes. But if you want to start this the most successfully with the lowest risk of irritation, this is what I suggest. Now, when it's time for you to actually apply the Tretinoin, we often say used a pea-sized amount, and that size of a pea seems to be very confusing for people because I get it. Not like what pea are we talking about here. So I will often tell my patients the size of an M&M or a Skittles. I love candy. And the tricky thing about using such a small or conservative amount of Tretinoin is that people can struggle with spreading it over the entire surface area of their face. And so what I recommend is we put that little dollop on the tip of our finger, we tap our little fingers together, so we have it evenly distributed on our pointer fingers. And then what I do is I do these little tiny dots starting at the periphery of my face and working towards the center of my face. And that's gonna help distribute it better. And then when I rub it in, it's just connecting the dots. And if you are beginning, I will have you avoid the little crooks around your nose and around your mouth area. Those tend to be the areas that are the most sensitive and tend to peel with Tretinoin, and you don't need to apply the product directly there. When we're talking about successful Tretinoin application, I do want to take a second to talk about the sandwich method, because this is spoken about a lot. It's something that a lot of dermatologists, including me, will recommend if you have very sensitive skin. And that is where you are sandwiching your Tretinoin between 2 layers of moisturizer. So you cleanse, apply a thin layer of moisturizer, then apply your Tretinoin, just as I instructed, and then you put another layer of moisturizer on top. I usually have my patients start by just applying their Tretinoin on dry skin. But if they go through those first 1 to 2 weeks of using it just twice a week and they're having irritation even from that, I will have them move to the sandwich method and just sort of ramp up using that. But no matter what with Tretinoin, you're always going to be following it with a moisturizer. And as you're ramping up on the nights that you are not using your Tretinoin, all you're doing with your skin and care is barrier support. So gentle cleanser, maybe a hydrating serum, moisturizer. Keep it really simple and gentle. Don't include any other actives. No peptides, no antioxidants. We don't want anything else potentially stressing out your skin because the main priority is being able to tolerate that Tretinoin. And then once you can tolerate that Tretinoin really consistently, then we can bring some other activives in, which I'll talk about in a second. Granted, I'm a little biased because it's from my brand Prequel, but my all-time favorite moisturizer for helping people tolerate Tretinoin is the Barrier Therapy Cream from Prequel. It has 1% colloidal oatmeal. It's super gentle. It's not gonna break people out. It comes in a huge tube so you can use it on face and body. And if you pair this with your Tretinoin, I guarantee you will have more success if you were previously getting a ton of irritation. If you don't have access to Prequel, I will also put some of my other favorite moisturizers to pair with Tretinoin in the description box. Now, I do have some caveats to this. If I have a patient who's been using vitamin C daily consistently for years, I'm not gonna have you stop that to start Tretinoin, but I would never start other actives at the same time as Tretinoin, and ideally, we are getting up to using Tretinoin at least 5 nights a week. And once you're able to do that, which is usually 6 to 9 weeks into your Tretinoin journey, then you can start bringing other actives in. Whether that's you want to start a vitamin C, you want to do a peptide serum, you want to start incorporating like a salicylic acid wash or other types of exfoliation. Don't do that until Tretinoin is solidly in your routine, because out of all the ingredients you could have in your routine, Tretinoin is going to be doing the most heavy lifting. So I feel like it should be prioritized. This might be controversial, but I would rather you use your Tretinoin every night and not use an antioxidant because you can't tolerate both than use Tretinoin a couple nights a week in your antioxidant regularly. Tretinoin is that powerful. Now, it's normal when you first start Tretinoin to have a little bit of peeling. But if you feel like your skin never stops peeling over the course of many, many weeks, even when you're only using the product 1 to 2 times a week, and you're using the sandwich method, and you're using the lowest concentration of product, then it's time to re-strategize with your dermatologist. And often if I have a patient like that, I will drop you to a non-prescription retinoid because Tenino and your skin just clearly cannot agree with each other. And that's okay. You can still get great benefits from a non-prescription retinoid. And I have lots of YouTube videos about them. So if you want some recommendations, go check them out. I also want to take a second to talk about purging because some people will notice that they had maybe no acne or very mild breakouts before they start Tretinoin, and then once they start incorporating Tretinoin regularly into their routine, they have more breakouts, and that can be very confusing because Tretinoin is meant to treat acne, not cause it. So sometimes this happens because of the phenomenon called purging, because Tretinoin increases cellular turnover and it's essentially clearing out your pores. When you start Tretinoin, you might have some gunk down there, and Tretinoin brings it to the surface over 6 to 8 weeks. Typically, that's going to be a temporary acclimation period. And then once your skin has sort of purged, you're going to have clearer, more even, more predictable skin as you continue on in your Tretinoin journey. So typically, if a patient is in their first 6 to 8 weeks of Tretinoin, or they haven't ramped up to very consistent use, which in my opinion is 5+ nights a week, I usually have them try to work up to using it more consistently as long as they're not getting irritation, to see if that purging goes away and their skin gets clearer. However, for some people, when their skin gets irritated, it will break out. And if they're getting irritation from the Tretinoin, that's not a true purge. Their skin is just freaking out in response. Often that is going to be breakouts that are accompanied by more redness, stinging, peeling, and extend far beyond that 6 to 8 week purging period. Although that's not very common, it does happen from time to time. And if someone is really struggling to tolerate their Tretinoin, or they feel like it's making their breakouts worse, we may talk about using a different retinoid like prescription Terotene or a different format of that Tretinoin. Whether if they're using a cream, then we might switch them to a gel. If they're using a gel, we might switch them to a cream, or even go to a brand name Tretinoin, because sometimes the vehicle can be a little bit different. The way it applies can be a little bit different, and sometimes they may tolerate it better. But I almost always start with generic because that's going to be the most affordable and consistently performs well for most patients. Okay, now for my favorite part, I went to the comment section of my other YouTube videos and pulled some of the questions that you guys had, and I tried to choose ones that I think would not only help answer that person's questions, but be more helpful for like a wider audience who's trying to have success with Tretinoin. So let's get into it. Tim Vander 4792 asks, how do we best use prescription of 0.01 estradiol and a prescription of Tretinoin? So the use of topical estrogen in anti-aging skincare has become more popular probably over the last 5 years, although US dermatologists have been recommending it for decades, and the reason for that is estrogen can help strengthen the skin barrier. It can help with depleted, dehydrated, collagen deficient skin. And what it offers for someone who is permenopausal or postmenopausal can be very complementary to what someone's trying to achieve with topical Tretinoin application. And when it comes to layering topical estrogen with Tretinoin, there's no one way you can do it. I have patients do it all sorts of ways and they've all found success. So sometimes I'll have a patient use their estrogen in the morning and their Tretinoin at night. But if they want to have a very simplified anti-aging nighttime routine, I'll have them wash their face in the evening, apply their estrogen, apply their Tretinoin, apply their moisturizer, but they can really be stacked on top of one another. You don't have to worry about them interfering, and sometimes incorporating topical estrogen into someone's routine actually helps them tolerate Trino better. I don't recommend topical estrogen across the board for everyone, but if you're interested in using estrogen in your skincare routine, I absolutely recommend checking out my other YouTube videos that dive into the science and the techniques of that. KKVM619 asks, which would have more impact, Tretinoin with the sandwich method or medicate retinol? So that's retinaldehyde on bare skin. I can tolerate medicate with no irritation, but can only use Tre with a barrier underneath. Does that make it less effective? This is a really smart question, and I would say that sandwiched Tretinoin is generally going to be more impactful than retinaldehyde even used on bare skin. And the reason for that is Tretinoin is all trans-retinoic acid. It is the molecule that actively stimulates the retinoid receptors in your skin. Whereas retinaldehyde, like the medicate formula, needs to be converted in the skin to all trans-retinoic acid before it can link to that receptor. And so there's more variability in terms of how much of that molecule is actually going to end up in its active form and stimulating your skin. So when you're sandwiching Tretinoin, yes, you may be slightly lowering absorption because of that buffer, but you are still delivering active molecule to the skin. And although I don't think there is any head-to-head study that exists that compares retinaldehyde to buffered Tretinoin, I would suspect that that Tretinoin, because of that reason, is still going to have more of an impact. But don't get me wrong, I absolutely love retinaldehyde. It's what I use on my neck and chest because Tretinoin in any format just has no success there on me. I get way too irritated at Julia Jones 7779 asks, is it possible some people don't see results from Tretinoin? I used it for years. It never purged my pores. My pigmentation never got lighter. The only thing it did was occasionally make me flaky. First of all, Julia, very valid frustration. This is not the first time that I have heard this complaint, and I think there's a few things that could possibly explain it. First, I would want to have a little bit more context. How frequently are you applying your Tretinoin? What concentration are you using? What else are you layering it with? Because the best data for Tretinoin and seeing those anti-aging effects and those acne effects really happens when you are using your Tretinoin every single night. And so it is very common in my practice that someone feels like Tretinoin doesn't really work for them. But then we get into the details and they're really only using their Tretinoin 1 to 3 nights a week, which is really not enough frequency to see meaningful results. I would also say how Tretinoin impacts hyperpigmentation for people can be very variable. Some people have a lot of improvement with their brown spots when they use Tretinoin, some people less so. And again, that has to do with what else is in your routine. Are you wearing sunscreen every day really consistently to protect those results? Are you using any acids or other things in your routine to help with the penetration of your Tretinoin? So I need a little bit more information there, but I would say Tretinoin would not be the one thing I would start someone on if pigmentation was their main concern, but often it does get better with consistent Tretinoin use. Now, if someone was truly using Tretinoin every single night for at least 6 months and they felt like it did nothing for their skin, I would pivot you over to tazarotene. That's our other prescription strength retinoid. And there are just a subset of people who don't respond as well to Tretinoin and do better with tazarotene, but also vice versa. Brandymore6599 asks, what about tazarotene? I keep reading it's faster, more effective than Tretinoin. So Tazarotene is a 3rd generation retinoid and it binds to the retinoid receptors in your skin with more affinity than Tretinoin. And it's a little more specific in terms of which receptors it binds to. And we have great data when it comes to how it helps with photoagging and acne. The trade-off is that tazarotene in studies has consistently shown to be more irritating than tretinoin. So it's not that it's ineffective, it's very effective, but oftentimes it is more poorly tolerated. For that reason, it is the general practice of dermatologists to start patients on tretinoin first. But there are going to be a subset of patients who tolerate tazarotene more successfully, as I mentioned before. So if someone is not able to tolerate tretinoin or has a particular interest in starting with tazarotene, I have no qualms about that. You start it the exact same way you start tretinoin. You're looking out for all of the same side effects, and sometimes insurance covers one better than the other. So oftentimes we are a little bit bound by what the patient can afford and what they have access to. Yvonne Delgado 4789 asks, what about using a little Tretinoin under the eyes? I keep hearing you can also use it and that you can't. So yes, you can use Tretinoin up around the eyes, but I will give you some caveats. Number one, the skin around your eyes is the thinnest skin on your body. So it's likely to be the most sensitive. So if you're having any irritation, redness, peeling around your eyes, put an eye cream on first. First, use it as a buffer, then apply some tretinoin. But if even that can't be tolerated, then tretinoin around your eyes just isn't going to be for you. The other thing I really want to caution you about is we have little oil glands called meibomian glands that line our eyes, and those oil glands help keep our eyes hydrated and help them not feel dry. And tretinoin can kill off permanently those oil glands. So some people, especially if they are prone to dry eye, will notice that when they use tretinoin, even not around their eyes, that they have dry eye symptoms. So if you are concerned about dry eyes or you are noticing dry eye symptoms, when you are applying your tretinoin, I would keep it far away from your eyes. And if you remove it from your eyes and you're applying it on your face and you're still noticing dry eye symptoms, then it's time to stop tretinoin altogether and pivot to a different anti-aging topical. All right, we are at our final office hours question. If you are still watching this video, give it a like. Make sure you're subscribed to the channel. Linda Benson, 1764, writes about getting an unpredictable tinino and burn on her neck even after tolerating it well on her face for a long time. Neck skin is thinner, it's more delicate. It doesn't have as many oil glands, and so it tends not to tolerate tretinoin nearly as well as facial skin. And I feel like your instinct here is exactly right, which is to switch to a non-tretinoin topical for your neck area. So keep the questions coming, and if you have suggestions for another Derm Office Hours topic, definitely let me know in the comments. Thank you so much for being here, and I will catch you in my next video.